Someone, Rosafon, I can see your hand up. Is there anything you want me to do? Yes.
Good morning, Hajia.
Good morning, madam.
Please, it's like your screen is half. We can't see your face fully.
Can you now see me?
Yes, I think it's better. Thank you very much.
You're welcome. Okay. So let's start. We are going to talk about the uterus. We are done with the vagina. We have treated the vulva. We have done the gross structure and the microscopic structure of the vagina. And so let's see. I told you we are following the Mullerian ducts. And so now we have reached the cervix and then the uterus. But normally, the cervix is part of the uterus. So when we handle the uterus, then talking about the cervix alone, the meaning will be so clear. I hope we can go by it that way. Now the uterus, somebody should describe the uterus. I need to know your foreknowledge before, or your previous knowledge before I can also come in. Somebody should. And one thing I want to plead with you is that we are adults. So adult learning, you need to solicit for the views of the adult, your students, before you chip in and then you bring what you have, because you all know. Not that you don't have an idea, you know. So just tell me what you know about the uterus. Per mensa. Just say anything at all that you know about the uterus so that I can also chip in. Or anybody, please. If you have an idea about the description of the uterus, just raise your hand, tell us something, then you can add. If you describe it, that is all, then we take it. And Louisa of Arabia. Louisa, you are the next course rep. Yes.
Sister, please, good morning.
Good morning.
Please, I just called Hajia. She said you can continue. Hey, Sister Drowa, she said you can continue with the labor.
Thank you very much. I'm so grateful.
You're welcome.
Thank you. Okay. But I can still see your hand up. Can you tell us something about the uterus?
What's the word though?
Okay, Deborah Kofi. Tell us something about uterus.
Okay. What I know about the uterus is the uterus lies at the cavity of the pelvis, and it can be seen or it's behind the bladder and in front of the rectum. And we learned it in our tertiary NMTC that it is a thick muscular hollow organ that opens into the floor of the vagina. And it is antiverted and anti-flex. When it rests on the bladder, it rests on the bladder when a woman sits.
Don't call me.
That's what I know about the uterus.
Thank you very much, Daddy. I'm so grateful. You miss. Please, I've already told you that if you don't take care, I will put you in the waiting room. And we can never join the class again. Because you didn't pay school fees only to come at the third practice. I don't think that is the rationale behind you coming to school. So keep quiet. This is the time. Okay. I'll give you the last chance. Let's move on. Okay, the uterus. Kofi, I'm so grateful you have described at least what you know, and it is welcome. What you said is true. The uterus situation, it is situated in the pelvis, in front of the rectum and behind the bladder. Of course, some people say behind the bladder and the symphysis pubis. The front of the uterus. It is shaped like, and some people will say English flattened. Some will also say it is shaped like a balloon that has been blown.
Hajia. Hello, Hajia.
Yes, please, I'm listening to you.
Hajia, we didn't finish, we didn't do the vagina.
We didn't do the vagina.
Yes, please. You were left with perineal body.
So we haven't treated the vagina. Is that what you are trying to say?
Yes,
Yes,
please.
sister.
Yes, sister. Yes, sister.
Now that I described, and we even sang the vagina song.
No,
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 it's
sister.
vulva.
It was a vulva.
It's vulva.
Eh,
It was
oh,
vulva.
Yes,
We
the
ended that
woman.
okay.
genital triangle.
Okay, then since you are not saying the same thing, I will accept it. I thought I've
And
done
and the perineal body to Hajia.
it. I've
We didn't do it.
We didn't treat the perineal body.
We did it.
Hey, we have treated the perineal body.
Yeah, body. We didn't finish the perineum.
We have treated that one.
No, she didn't finish it. The time was up.
Oh, okay.
Please, Hajia, anal triangle, uterogenital triangle, and then the time was up. We stopped.
Okay. The perineal body. It is a neuromuscular prism. In fact, I thought maybe somebody should complete it. That's all. So, only with the exception of the perineal body. It's like we're moving forward and backwards, and we will never finish. So please, somebody should complete the explanation of the perineal body. Yes. Dr. Sumi, please describe the perineal body.
Thank you, sister.
Good.
Sister, to my understanding, it is a fibromuscular pyramid between the vagina and the rectum. It is triangular in shape, with its apex pointing upwards, and the base in the skin. That is all what I can remember from my NMTC.
Good. Thank you very much. Somebody should complete it. So it's a triangle-shaped structure that is situated between the vaginal orifice and the anal orifice. The skin covers the exterior part or the external part, and hair grows on it at puberty. It is made up of the following muscles. We have the lateral side being the transverse perineal muscles, and then the powerful cavernosus. The powerful cavernosus, they are all superficial pelvic floor muscles. They help in the formation of the perineal body. Important thing may different is that when you are to give episiotomy, if you know these anatomical structures that are come together in the formation of the perineal body, then you'll be mindful when you are cutting through it. You should know whether you're giving the J-shaped cut, the mediolateral, or the lateral type of incision that you are making. These muscles are being inside. And for that matter, when it comes to suturing, you try to suture it in such a way that it will be in proper alignment. Other than that, when it overlaps, for example, you have to unite it. But if it overlaps, what happens is that healing will take place, and then the individual will always end up having what we call dyspareunia, that is painful sexual intercourse. It's all coming about because who suturing? Because you didn't know, maybe you didn't remember that the perineal body is joined below the transverse perineal muscle. What its center is formed by the oval cavernosus. We are saying it is shaped like a pyramid, and that's why every pyramid is shaped like a triangle. But this one has a pointing up, and then the base below. It measures 3.5 centimeters in all angles. Being a triangle, something like this. That way. We all know what a triangle is, so that if I can use my something like this, it's triangular in shape. And the measurement, some people say is 4 centimeters, but if you measure 3.5 centimeters on the ground, then that is also accepted. Units are penal about Willis. I'm giving you the last part before I put you in the waiting room. Whatever your child is using to make noise, take it from here and stop making that noise. You are mature person, don't do that and let's put you in the waiting room. Today, everybody is supporting herself except you and your children. Don't do that. Okay. So I'm saying that there is neuromuscular pyramid or prism, as some of the books will call it. It's very important to make it free because one, if it's even the perineal tape, this structure is going to be affected. Especially the transverse perineal muscle will be seriously affected when it comes to the second degree or third degree tape. Now, what you are to give the episiotomy to widen out the vaginal orifice to facilitate delivery. So you cut through this structure. The incision will pass through it before it will be susceptible to open up the vaginal outlet. And so care must be taken when we are giving it. Now, when it comes to pelvic floor muscle exercises, this perineal body plays a vital role. You need to teach the clients how to do the Kegels exercise. It is these muscles that we are trying to, let her exercise so that it will unite, it will come closer in cases of lapses. Sometimes it will get weakened just because of persistent delivery. This, what do you call it? Perineal body will become weak in the succession of pregnancy and deliveries. For example, gravidity, parasitic. You see, it's a great pressure on the perineal body. And then at a point in time, it can no longer stretch. During delivery, this perineal body will stretch. It will stretch to widen out the vaginal outlet to facilitate the delivery of the baby during the second stage of labor. So you see, it's important to make it free. And therefore, when it comes to management of second stage labor, we plead with students and we are telling our colleagues midwives that don't try to support the perineum. People have been talking about support the perineum, support this perineum. Because we think we are supporting the perineum. By so doing, you are causing injury. You are causing bruising by holding the perineum. The perineum is the skin that supports the perineum. So when you support it, you are rather inflicting injuries. You need to guide. You need to guide the perineum. For example, when the minister is coming and they say that is the body guard, the body guard, you didn't touch the minister. You touch the minister, no, but they are counting him. They are counting the body guard is counting the minister or the president, but they don't get hold of him. So it is with this perineum and the perineal body. Get hold of the perineum. And then when you start labor, when you come to the second stage, but I'm saying it so that when you reach labor, you will understand me. You don't need to touch this perineal body. You don't need to touch the perineum, but you guide, observe the place. About to take, you will see tiny cracks, some white lines. Cracks, then it tells you that the perineum is about to tear and therefore give episiotomy. But if you read the perineum how to hold it like some of you are doing, you put it and you provide the system, you can't. By holding it, by bringing it together in something, mind you, she will have, if the way it takes, she will have internal tear. The transverse perineal muscle that helps in the formation of the perineal body will tear from inside. If the way tear, then therefore, what is the biggest loss? Why don't you give the episiotomy so that you can get a straight line to suture? Please, if that's okay. Is that okay? Now,
Yes, Hajia.
go. You realize that the perineum fills out, it stretches, and it will not pain. When we're doing that, it is doing that so that internally the vagina will also be stretched. It will also be stretched to facilitate the delivery of the baby. So that is what I'm saying about the perineal body. Any question? Any question? Well, of course, it is the potential active that supply that supplies the power, supply the perineum and then the perineal body. Middle is by the corresponding beats. And then the nerve supply is also from the sympathetic and parasympathetic nerves from the lymph and caudal plexus. They supply the perineal area with nerves. It doesn't talk much about it, but the most important thing is what I've told you, with respect to midwifery. So that is it. Can we move on to the vagina? You are saying I didn't teach you the vagina. You are seeing it. Okay. I'm surprised. I'm surprised. Well, you are saying so, take it like that. Any question? Can I move on to the vagina? Because vagina, yes, which they most manage. Okay, if you are saying I didn't teach you, I'll teach you. Can I move on to the vagina?
Yes.
Yes,
Okay.
yes,
Okay. The vagina, we are saying that it is a potential tube or it's a potential canal. The vagina is a potential canal or a tubular structure. And it lies parallel to the plane of the pelvis. The vagina lies parallel to the plane of the pelvis. It extends upwards. It extends upwards. And then open at the vagina orifice at the best at the vulva. So I'm saying that the vagina is a potential canal which runs parallel in the plane of the pelvis, extending from the cervix to the exterior, that is to the vulva. I'm going to talk about the measurements. So look at this one. The way I've made my hand, look at it as the vaginal orifice, which is protruding through. The thing protecting to the vagina at the right angle. So please, if you can see my hand, my 2 fingers, this one is clear. Don't say you don't see. To be the cervix, so the cervix is entering the vagina. Please, are we okay? Can we see? So that is the cervix. This is the cervix. It has entered the vagina. Now, let me use one hand. So the cervix has entered the vagina. Now, it enters it at a right angle. The cervix enters the vagina at a right angle. And that will create some porches. It will create porches, a porch. And that porch is what we call formative. So anterior, you see there's a porch here. Look at it. This side. That is a porch. And then posterior, you have another porch there. Then the lateral, 2 lateral porches, and that is what we call it, 2 lateral fornices. Now, because of the way the cervix enters the vagina at the right angle, using these fornices or porches, it makes the material to be longer, measuring 11.5 centimeters. Please, I'm talking about the measurement of the vagina. The cervix enters the vagina at a right angle, and the fornices or the porches that it creates, the posterior one, because of the right angle which has the cervix, it makes the posterior one to be longer than the anterior one. And so I'm saying the posterior fornix measures 11.5 centimeters. Plus the anterior fornix measures 7.5. You see, is shorter than the posterior fornix. The two lateral fornixes. You see, if I put my hand, you'll see, I think you can see the spaces at the sides. That is the two lateral fornices. It doesn't have much significance in midwifery. The important in midwifery is that during pregnancy, when there's increased blood supply to the vagina, you realize that the lateral wall will be pulsating. The lateral wall of the vagina, that is the lateral fornices, will be pulsating. It will be pulsating because of increased blood supply to the vagina. And that is what we call the Jacquemin's spine. Jacquemin's spine. It's a positive sign of pregnancy. And so that is insignificant, the lateral wall. That is insignificant in midwifery. I hope that is clear. Are you together? Are you together? Can you hear me?
Yes, sister.
Yes, we can.
Good. Good.
Okay.
Now, the inferior aspects of the vagina is covered by a very thin membrane, that we call hymen. But this hymen is separated in the center. The center part of the hymen is separated, and that allows for the passage of product of conception, passage of menstrual fluid, and also an exit for the penetration of the pelvis during sexual intercourse at puberty and after puberty. That is the essence of the perforation in the center of the vagina. I'm going over it. I'm saying that the vagina is covered externally around the vagina orifice. There's a thin membrane covering that place we call the hymen. And that this hymen is perforated in the center. And the essence of the perforation is to allow for the product of conception to come out. That is the fetal, placenta, membranes, like to pass through, the woman becomes pregnant and she goes to deliver. Now, this hymen also, the perforation also allows for penetration of the penis during sexual intercourse. So that is the essence of this. You are lucky. I wanted to put her in the waiting room. She has corrected herself. So that is it. Now, apart from the hymen being opened in the center for all these purposes, when there's any infection, for example, when the woman ends up having maybe pelvic inflammatory disease, and there's this time, maybe past formation, it is through the same vaginal orifice, through the hymen, that this infection will come out or will drain out. Now, this hymen, I said, normally it gets broken. It breaks up during the first sexual intercourse. I hope we are together with the lesson. I said the hymen breaks up.
Please, your network is not stable.
Network is not stable. Whose network is not stable? Who?
Sister, my network is not stable.
Your network is you, yes. So let it be stable over there.
Sister, no, your network, your network, is not stable.
Guys, from your studio.
It's from my studio, it's not stable, eh?
Yes, your network.
Sister, please, it's breaking.
Your network. It's not clear at all.
Oh, I see.
I'm sure it will be from your microphone.
Okay, then let me check So they are saying. Hello.
Hi.
Hello.
Yes. Can you hear me now? Can you hear me? Can I continue? Yeah,
It's
that I
better
was
now.
saying.
Yes, sister, it's okay.
Okay. What that I was saying is that the vagina is a potential canal or a potential tube. What potential tube means the walls are in a position, but it can easily be dilated. And I said it runs around through the plane of the pelvis. It extends from the cervix area to the exterior, that is the vulva. And I said the cervix projects into the vagina at a right angle, creating pouches, also known as pollicis. And because the cervix is projecting into it at a right angle, it makes the posterior pollicis to be longer than the anterior pollicis. So the posterior pollicis, I said, it measures 11.5 centimeters. That is the posterior. Then the anterior pollicis measures 7.5 centimeters. And the two lateral pollices, and I said the two lateral pollices haven't gotten much significance immediately. However, during pregnancy, because it increases blood supply to the vagina, it allows the lateral pollices, the lateral wall of the vagina, to be pulsating. It will be pulsating like that. Why is it pulsating? It's pulsating because of increased blood supply, because the veins there are congested with blood, and so it will be pulsating. And I said that is what is called the Jacquemin's sign. Jacquemin's sign, which is a positive sign of pregnancy. And then I said at the external part of the vaginal orifice, it is covered by a thin membrane known as the hymen, which is secreted in the center to allow for product of conception to come out through the vagina. It also allows for the penis to enter the vagina during sexual intercourse. Again, this hymen, I said, the first sexual intercourse, during your first sexual intercourse, it will break no matter what. Your first sexual intercourse, the hymen will break. And as I say, right now, all of you have remembered the one who broke your hymen. True or false? Tell me. We have all remembered, haven't you?
And mine is not
Virgin.
If you are a virgin, then I'll look for
We
someone.
are all virgin.
sister, me, I'm still a virgin.
Woman sister. Intact.
Oh, okay. I'll tell somebody to come and break it for you. The
guys are there. We the guys
I'm
are
still
there.
a virgin. You are virgins with 3 babies.
I'll come and break it for them all. We the guys are there. Hajia, we'll come and do it for them. We'll come and break it for them.
Be careful, Stephen. Be careful.
Stephen, be careful.
Yes. So the gentleman they will break it for you. Now I'm saying that
They can't
once the hymen is broken, while the hymen is broken, and then maybe you have sexual intercourse after when you become pregnant and you deliver, following the first childbirth, this hymen that got broken during your first sexual intercourse will break further. It will break further, and then parts of tissue that is called caruncular multiformis carunculi multiformis. Carunculi multiformis. For that, the remnant of the broken hymen, the hymen that got broken during childbirth, that is how the vagina will look like. The external part of the vagina, that is how it will look like. That is filled with carunculi multiformis. So, that is the broad structure. The broad structure of the vagina. Any question before I move on to the microscopic structure, that is the layers that form or that constitute the formation of the vagina. Do you have any question on the broad structure? What do you mean by broad or macro? Is if the vagina were to be sitting here or lying down somewhere, what you can see with your naked eye. That is what we mean by macroscopic structure or broad structure. Is that okay, please? Can I move on to the MI, the microscopic structure? Somebody has a question.
Yes, please.
Yeah, Priscilla, you have a question. Priscilla,
yeah. Yes, please, Hajia. Please, from your lecture, you said that the hymen has perforation.
In the center.
In the center, okay. So that place allows the menstrual flow if the person is still a virgin.
Yes.
Oh, okay. Thank you.
Yes. That is it. That is it. But you see, mothers of today, because we midwives have failed to educate them during the period when they are discharged from the hospital, how do we give them education? We don't educate them, but they go home. So they go home with the baby, especially the baby girl. And when the grandma is birthing this baby girl, they have a way of putting water inside the vagina. They will perforate the center of a milk tin, empty milk tin. Then they use it to fetch water, raise it at a height, and then you are putting water inside the vagina of that newborn baby. The height and the force that the water is using to come out is enough to break the hymen of that poor girl. You are there. You don't educate the mothers when they are going home. And she also doesn't know. So she will allow the grandmother to do that. I made some investigation, and most of the mothers were saying that there's wounds, that there's sore in the vagina of that poor girl, baby girl, there's wound. So I told the grandmother, I said, no, if you want to dress any wound, it's not that girl's vagina that you should put water there hot water there to heal any wound. It is the mother. The mother should rather lie down so that you dress that wound of a vagina. She's rather having wounds. She had cracks, she had abrasions during childbirth. And the baby doesn't have anything. The baby doesn't have any wound. So stop putting water there. They will do that to break the hymen of that poor girl. And so the girl is no more a virgin. Those of you who say you are virgin, they have already broken your hymen before you allow the penis to go. So that is it. And then another thing that can also break the hymen is an overactive girl. Some girls from 6-10 years, they are very, very active. Jumping, doing this, using skipping, it can also break the hymen. It can yes, excessive exercise.
Riding bicycle.
Riding bicycle, yes. It can all break the hymen goes. So there are a lot of things that can break the hymen. And then sometimes too, you may resist having sex with your partner from the beginning, the first day you met. Now, no, it's too early for us to have sex. But this guy didn't agree, and he used his hand. Once he introduces the hand, he brings the hymen. He brings the hymen. So that is the whole about issue about the hymen. Now let's quickly talk about the macroscopic structure. I'm starting from inside outwards. I'm talking about
hello, Hajia.
Yes, madam.
Please, I want to ask a question. That's why my hand is up.
Oh, yeah, I didn't see. Eva, go ahead.
Yeah, Hajia, please, I want to find out. You see, when E. coli is introduced to the adult's private vagina side, you get UTI. But when the children, they can pass stool and it will swell all over their vagina, vulva, and this thing. But they don't get infection like that. So I want to find out, is it as a result of the hymen? That is why.
Okay. Well, the hymen in a way, protects it. But remember, the E. coli that we are talking about, it starts developing from the rectum. The Escherichia coli, it starts developing from the rectum. Now, in the rectum, they don't cause any infection. I'm talking about the adult age and the what you call the adolescent age. In the rectum, that is where they are produced, but they don't cause any harm. They are there. Some books, last time I was reading a certain, we said they are there to help in the production of vitamin B complex in the rectum, right? But the moment they leave the environment, the rectum, and then get into the vagina, they start multiplying, causing infection, itchiness, and other things. That explains that. But the children, if a child is not happening because this thing, there's two on the baby. There's two. If it's contaminated with E. coli, that's tender age. No. And so when the person's physics, and then some get to the border, we reach there, and then the baby is fine. So that colonization of the E. coli in the baby's food, it's not adequate, not adequate, but they are not matured enough to cause infection in the baby's vagina. And apart from that, the environment is also there to protect it in a way. So that is it.
Okay, thank you.
You're welcome, Rita. Rita Sapo. Okay. Rita, go ahead. I can see your hand up.
Yes, please. May I know the UTI? Is the infection caused in the vagina or in the urinary tract?
It's a urinary tract. Her question is, the whole place is messed up with urine, and with feces. So obviously the vulva, if I did understand very well, it is the vulva that is messed up with feces. And so UTI will not set in that poor baby. Neither will she get vagina itchiness, all because the toilet messing up the place. That's why it's good that we as midwives, we have to educate the mothers that when the child has the stuff, try to wash after cleaning.
Yeah, you check it. Take my call.
Sharifa, be careful. So that explains it. The UTI is through the urinary tract, but sometimes there's vulvar itchiness. That is why we normally educate them that when they are cleaning the vulva, they should clean from front backwards. They shouldn't clean from backwards forward, because that even like in the stool, if you clean it from backwards forward, we'll get access to either the vagina orifice or the urethra orifice. When they are not, that is not their place of habitation, and they will start multiplying, causing infection. I hope that is clear. And if you remember, UTI and vulvar itchiness, I wouldn't say UTI, but vulvar itchiness is common. It's common among the teenage, the elderly.
Sharifa too.
Sharifa, let me find a way of putting Sharifa in the waiting room so that you can pass. Sharifa, who is the part of this? I pity her too. I'm pitying her, other than that, like I've put her in the meeting room. I've already put her there. I'll put her there. You should go. And let us continue our history. Okay. So I'm saying that the teenagers and then the elderly, normally they end up having a vulvar itchiness. Why? Because the estrogen, one of the functions of the estrogen is to help to maintain the vagina and the vulva, prevent infection. But then, because at that teen age, the estrogen level is low, and after menopausal age, the estrogen level is low. And so take it, the vulvar itchiness is common among the teenagers and the elderly. So I hope it's clear. We are getting the whole physiology. So that explains why we always have to advise them to clean from front to backwards and not from back. I hope that is clear. Okay. Okay. So that is it. Please, can I continue with the description?
Yes, Hajia.
Okay.
Hajia,
So,
please, I have a question.
You have a question, eh?
Yes, Hajia. Hajia, please, through the lectures, you said the hymen further breaks down to form the caruncular metiformis during vaginal delivery. Hajia, what of those who have not had vaginal delivery before? They always go through CS.
What is the guarantee that they never had an abortion? If truly the cesarean section is a paired delivery, really, then the caruncular metiformis, even if it would be there, it wouldn't be that much.
Okay, Hajia.
It wouldn't be that much. So that is it. Okay.
Thank you, Hajia.
Good. You're welcome. Now, we said that the vagina is, I'm talking about the microscopic structure of the vagina. Microscopically, I'm starting from inside outwards. Inside, so picture exactly. It is inside, you can't see. That's why when you're doing vaginal examination, you can't see, you only imagine. So imagine a tube that is having layers. That is what I'm describing. The lining of the vagina is made up of stratified squamous epithelium. The inner lining of the vagina, I'm saying that it is made up of stratified squamous epithelium, which is thrown into folds. It is thrown into folds known as the rugae. Some will say rugae. Whichever way you pronounce it, it will be accepted. It is rugae or rugae. The essence of the rugae or the folds, the essence of it is that, one, it helps in stretching out, to widen out the vagina during the second stage of labor, for the baby to come out. So it helps for expansion. Apart from labor also, the mature vagina with this rugae, during sexual intercourse, once you are able to secrete the Bartholin glands secreting and making the place more moisturized or slippery, any size of vagina of the penis, you'll be able to accommodate it. Because of the presence of the rugae, it helps the vagina to stretch out, to expand, so that you can enjoy any type of penis that is entering. It wouldn't be inflicted with pain. That is it. Other than that, had it not been the rugae, you are first sexual intercourse, you'll be screaming, you'll be making noise. It is not the noise that is the enjoyable noise, but it's a noise that is painful. But the rugae is there, is to help you, and there to help you to be able to accommodate any size of penis. So that is for the inner lining. We didn't know that squamous stratified epithelium. Now, the next layer of the vagina is made up of connective tissue, which contains blood vessels, nerves, and lymphatics. Whenever there are connective tissues, it contains blood vessels, nerves, and lymphatics to supply and drain lymph drainage from the vagina. The connective tissue is the next layer.
Louisa of Arabia.
Covering the connective tissue is another layer, that is muscular layer, which is made up of two layers. You know, the vagina has a very tedious work to do. So the muscles there are made of two layers. That is inner circular. It has inner circular fiber, then outer longitudinal fiber. The muscle layer I'm saying is of two folds. It has inner circular fiber, then outer longitudinal fiber to make the vagina very strong. Now, because it is a tube, I'm saying the entire tube, the entire vaginal tube is covered with pelvic fascia. It's covered with pelvic fascia. And that makes it a tubular in shape. So these are the microscopic structure. I'm going over the microscopic structure. So I hope when you meet it, you should be able to answer to perfection. Please. I'm saying the inner lining of the vagina is made up of stratified squamous epithelium. In fact, I talk about the stratified epithelium in the body. It's held to what you call, it's able to withstand wear and tear. Wherever there's stratified epithelium, for example, under the conjunctiva in your eyes, look at the number of times that you rub your eyes. Somebody may be rubbing the eyes as if she wants to scrape the epithelium lining the eyes, but the eyes will not do anything. It's because it is lined with stratified epithelium. Now, the stratified epithelium, I'm saying that in the vagina helps the vagina to withstand wear and tear. That's why probably when you have a vigorous effect, you will be complaining, especially after that you want to go and urinate, because of the activity of urine. You pass urine passes there, and you are as if you should cry. But crying. Then because urine is acidic, it's passing there, you are complaining of pain. But at the end of it all, true of course, is it not true? The cry, then it's like you should withhold the urine. You want to go to the urine. Then later, what can you do? You have to pass out the urine, then you urinate. But remember that with all this pain, when they want to go, we are going from where one wants to go the second one, you'll be able to allow him to do it because the epithelium can withstand wear and tear. I hope that is clear. Is it okay?
Yes, Hajia.
Can I continue?
Yes, Hajia, continue.
Good. Now, and I said the next layer is the connective tissue, which contains blood vessels, nerves, and lymphatics. And then following that one is muscular layer, which is arranged in inner circular fiber, outer longitudinal fiber. Then the entire tube I'm saying is enclosed in a pelvic fascia. So that is all about the macroscopic structure of the micro MI of the vagina. Now let's see before we come to the blood supply, let's see the relationship. The vagina and its relations. Every organ has its section for it has its other structures that are related to it. So when you take the vagina, please look at it. It's a tubular shape. This is the anterior part of the vagina, and this side becomes the posterior part of the vagina. So we are starting from superior, inferior, then anterior, posterior relations. Superior, the structure that is connected to the vagina or is related to the vagina, superior, it gets last. Please, if you know it, raise your hand. What structure or what organ relates to the vagina superior? Yeah, Jennifer Susanna. No, Jennifer.
The cervix.
The cervix. The cervix. Good. The cervix related to the vagina superior. Inferior is last. Magdalene Adukoku. Yes. Magdalene.
The vulva.
The vulva. The structure of the vulva. External female genitalia related to the vagina inferior. Now the anterior aspect. Anterior. Lydia Hatera. Lydia. Yes.
Hello, Hajia.
Yes.
Anteriorly is the base of the bladder.
And what else?
Rests on the upper half of the vagina. Then there is also embedded in the lower half.
Go ahead.
That's all I can say about it, Hajia.
Okay. Thank you very much. Yes. Somebody's hand is up. Matilda Van. Matilda.
Sister, please.
I will say the anteriorly, the urethra.
Good. So what I want you to do for you to remember and understand is that divide the anterior part into two. If this is the tube, this is the vagina, whole tube. The anterior part, divide it into two so that you get upper half and lower half. The upper half is relating. It's in relation to the place of the bladder. While the lower half is in contact with the urethra. The urethra is embedded in the lower half of the vagina. Now, posterior, the posterior aspect also divide it into three. So that you get upper one third, middle one third, and then the lower one third. So we get upper, middle, lower. So that is the posterior relations. Posterior, the upper one third is in contact with the utrovesical pouch, also known as the what is the other name for the utrovesical pouch? Cassie,
Hajia, please, your line is breaking, so I didn't get the anterior part very well.
Your anterior part. Can you tell her for me?
Please, he said the anterior part
Of the
you would
urinary
divide into two halves. So the upper half is the base of the bladder. It sits on it, and then the lower half is the urethra.
Good. So when you said my line was breaking, so she didn't get. Now you have heard it. Have you heard
Yes,
it now?
Yes, Hajia. Thank you very much.
Good. Now I'm at the posterior aspect. I said posterior divide it into three. You have upper one third, middle one third, and the lower one third. The upper one third, I said it is in contact with the utrovesical pouch. And I asked, what is the other name for the utrovesical pouch?
Pouch of Douglas.
Pouch of Douglas.
Pouch of Douglas. The pouch of Douglas. That name is utrorecta. The pouch of Douglas is the same as the utrorecta, but the utrovesical is in front. Utrovesical is in front. The vesical refers to the bladder. And so the utrovesical refers to the anterior part, right? But the posterior part is the pouch of Douglas, also known as the utrorectal pouch. I hope that is clear.
Yes, Hajia.
Okay. Then the thread is in contact with the rectum.
Hello, Hajia.
The thread is in connection.
Hajia, please, your network is breaking.
Yes, please, it's true. We are not really getting you well.
Yes,
Hajia.
It is because, do you know
Your
why?
network
Because
is
some
shaking.
people have left their microphone on mute. That is why. Some people have their microphones on mute. That is why her background is very noisy. So please, sisters, mute yourself and let's hear what Hajia is saying.
Thank you. Thank you very much. So I was talking about the can you hear me?
Yes,
Can you hear me?
I hear you better.
You need a pick again.
Abigail Wilson, Apik Eunice, Regina Rita, Cecilia. Mute your phone. Boama patience, mute your phone.
I think you need to mute yourself.
I've put her in the waiting room, so she wouldn't join the class again. Leave her. Okay. So that is it. Now,
Hello, Hajia.
yes.
Please, can you please go over the posterior aspects of the vagina?
So the relationship, I'm saying that the anterior relations, the upper half is in contact with the base of the bladder. The lower half is the urethra. That's what I said. The urethra is embedded in the lower half of the vagina. Posterior, I can divide that part into three. You get upper one third, middle third, and then the lower one third. The upper one third is in contact with the pouch of Douglas, also known as the retrorectal pouch. Then the middle third is in contact with the rectum. Then the lower third is in contact with the perineal body. So that is the relationship of the vagina. I hope that is okay. Let's move on to the blood supply. Because of the work that the vagina does, it does a very tedious work. And so all the structures that are in relation, that relates to the bladder, they all supply the vagina with blood. All the relations of the vagina, they supply the vagina with blood. So the first blood supply is from the vaginal arteries itself. The vagina must have gotten its own blood supply. So the vaginal arteries supply the vagina with blood. Now, the uterus is sitting on top of the vagina. So the uterine arteries also supply the vagina with blood. Then the vesical arteries, you know that we said one of the relations is the base of the bladder. So the vesical arteries also supply the blood, the vagina with blood. Then hemorrhageal arteries from the rectum also relates to the vagina posterior. So the hemorrhageal arteries also supply the vagina with blood. And then the pudendal arteries from the vulva, they also supply the vagina with blood. So the venous return is from the corresponding veins. So all these structures, their veins also drain blood after it has been used up by the vagina. It drains the blood out. Lymphatic drainage is into the inguinal glands, and some sacral glands also, but the inguinal glands also receive or drain lymphatics from the vagina. Nerve supply to the vagina is from the sympathetic and parasympathetic nerves from the lymph and Canhouser's plexus. So this is all about the vagina. The functions of the vagina. The function of the vagina is an outlet for menstrual flow and product of conception. It also allows the penetration of the penis during sexual intercourse. It involves after delivery. It goes back to its pre-pregnant stage after delivery, so that the size that it was from the beginning, it will maintain it as such. So, ladies and gentlemen, this is all about the vagina and its description. But please, there's something that I need to inform you. You know, some people, some mothers, as midwives, it is our responsibility to ensure that mothers' needs are met when it comes to physical care and other things. So we have to educate the mothers that after delivery, during the period, please let's spend about 5 minutes with the pregnant woman before she goes through, so that we educate them that as she's going home, not that she has delivered, she shouldn't think, or if she feels that her vagina outlet has become widened, she shouldn't be putting herbs and local spices into the vagina in an attempt to close it or to reduce the size. Teach them the dangers associated with it. Tell them that if she puts those chemicals into the vagina, in order to close the outlet, she ends up having cancer of the cervix, cancer of the vagina. Rather, teach them how to do the Kegels exercise to maintain the size of the vagina, to get it to be smaller if that is what she wants. I don't know whether the husbands have told them that they want it to be smaller, but after all, it is part of their body. The penis is part of their husband's body parts. And so if they put those spices there in order to constrict the vagina, you won't inflict injuries on the man. In an attempt for him to penetrate to enter during sexual intercourse, he ends up having a lot of bruises on the penis. And that explains why they are saying that sexual intercourse, STIs, including HIV, is mostly transferred or is mostly gotten through sexual intercourse. Through sexual intercourse, it's as a result of the fact that the woman either has inserted those spices to reduce the size of the vagina. You seal the vagina. Are you seeing those cacabrol and all those things that they put there? These are meant to seal meat and fish and prepare you. In a way, are you sealing your vagina? Do you have to seal your vagina? They shouldn't do that. But it is the responsibility of the midwife to teach the mother to ensure that she doesn't do that. But there are other things that she can do if she feels her vaginal outlet has become widened as a result of assistant childbirth. The Kegels exercise. And I think you all know how to do the Kegels exercise, don't you? Don't you?
Victoria Bonia, please, you're making noise.
You all know how to do the Kegels exercise. So teach the mother how to do the Kegels exercise in order to tighten the vagina outlet if she feels she has become too widened. And I'm asking you, I think everybody knows how to do that. Hello?
Victoria Bonia, you are making noise.
Can you hear me?
Yes, sister.
Do you know how to do the Kegels exercise?
Yes, sister.
Yes, sister. Yes, sister.
Good. So that is it. Please, that is all about the vagina and its description. That is all about the vagina and its description. If you have any question, ask me before we move on to the uterus. Rita Sapon, ask your question.
Hajia, please. With the warm seat bath, is it as advisable?
Yes, it is advisable if only the woman didn't receive episiotomy. If in the course of delivery, if no episiotomy was given, then we can encourage her to do the warm seat bath. It promotes healing. But if she had an episiotomy that was cinctured and she sits on the hot seat mat, the catgut or the product that was used will melt and the vagina will give. Then it will worsen the whole thing. It will become. Then you have spoiled the vagina for her. So it's good if only there is no episiotomy. Okay. Any more questions? Please, I want to answer your question.
Please, you've answered.
Okay. Any more question on the vagina? Any question? So that I said, teach the mothers if she knows she will go in for sex that night during the daytime, as she's walking about, she's doing an activity, then she can be doing the Kegels exercise. I keep saying that the Kegels exercise is the only exercise that you do and nobody sees it. It is the only form of exercise that you can do it at anywhere, at any place, and nobody sees that you are doing CODeL exercise. So you can do it at any place. Eunice, I'm hoping you are coming back. We are starting the noise. I'll send you back to the waiting room. You try me. I'll send you back and I will open you again. So you try. You try making the place again. You go ahead. You are not the only person with kids. So if everybody allows the kids to be making that noise, can we have the lectures? So you go ahead. So I'm saying that teach the mothers that CODeL exercise is the only exercise that one does and nobody sees that you're doing exercise. It can be done at the marketplace, in the church, in the home, when you're going to farm. You can do it. Nobody sees that you're doing exercise. So that by the time you get to bed in the evening, give yourself a try at midwife. By the time you get to bed, you see that the vagina has closed. It can become smaller the way you want it. The way you want it, you get it that way. So let's educate our clients. Good. Okay. Okay, any question?
You happy.
Hello.
Sister is having empathy for all, so she can't put her in the waiting room.
Okay, that is it. Any question?
Hello, Hajia.
Any question?
Hajia.
Yes.
Jacmere sign.
You say what?
The Jacmere sign.
Jacmere sign is the bluish discoloration of the vagina during pregnancy because of increased blood supply to the parts. That is the Jacmere sign. And the sinus is the position at the lateral cornices because of that same increased blood supply. So that is it. Okay. If you don't have much to ask on the vagina, shall we move on to the uterus?
Please, Hajia.
Yes, please. It's time for labor, eh? This one is time to draw my attention, okay?
Please, I was asking about the Dodderland's bacilli. I didn't hear anything from that.
The Dodderland bacilli, they are the normal product, normal inhabitants of the vagina. The Dodderland bacilli are normal inhabitants of the vagina. They are going to protect the vagina, prevent infection. They act on glycogen in the presence of estrogen and turn it into lactic acid. Are you getting it? It turns it into lactic acid in order to prevent infection, making the pH of the vagina 4.5. I'm going over it. Please pay attention. Thank you for reminding me. So I'm saying that the bacilli are normal.
Hey, Eunice.
I put her in the waiting room, leave it. You should make it my side. That's how
I'll free Eunice.
No, I put her in the waiting room, so don't insult her. It's okay. It's okay. She's now in the waiting room. She's waiting for me to open her. I'll finish the lectures, then I'll open her. Because she cannot be making undue noise like that. Let's move on. So I'm saying that the Dodderland bacilli, they are normal inhabitants of the vagina. So the vagina has a lot of microorganisms that are normal for, they are normal inhabitants of the vagina. We have the Staphylococcus there, Streptococcus is there, vagina is there. We have the Dodderland bacilli. They are there to protect the vagina, to prevent it from infection. But with Dodderland bacilli, what it does is that it's with the presence of estrogen, they produce what you call glycogen. And then the glycogen will be turned into what we call lactic acid. And it is a lactic acid, hence the name, look at the name, acid. So the lactic acid, in a way, will prevent infection. That is how the vagina prevents itself from infection. Now, the staphylococcus and the streptococcus, they are also there. The vagina is, they are all there, but they are normal inhabitants of the vagina, just to see to it that the microorganism that enters, it will fight it and get rid of it. And that is why we are saying, don't add chemicals into the vagina. Don't put chemicals, be it a cacadro ginger, be it what, put it there, because the moment you put it there, it disturbs the normal flora. It disturbs the normal organism of the vagina, paving way for infection. So that you may end up having candidiasis, which is caused by Candida albicans, also known as monilial infection, moniliasis. It's so because we went up tempered with the flora of the vagina. And sometimes goes up, you walk back and after often you leave half bucket full of water, and then it is the vagina that will be the sufferer now. Putting water there, washing, washing. You want to wash, and for what? You wash and wash and wash. Since you started washing, since recorded, since you were adult, you became an adult. Since you started washing, that whitish secretion, have you been able to get rid of it? It is still there. And if a potential tube, thinking that is in it, when it is time for it to come out, it will come out. You don't need to put your hand there to go and bring the secretion. I'm asking you this a general question. When it is time for you to get your menses, when it is time for you to get your menses, are you the one who put your hand inside the vagina and the uterus and squeeze and bring the blood out?
Yeah.
Salome.
No.
After this
please,
in the vagina. It is the part that we need to watch.
With the elementary unit and then the sample you were talking about.
No. That we need to watch. After the one, you can start. And then
you said for the elementary unit, it makes the individuals within the sample. Right. So indirectly with the soup example you made, can we term the ingredients used to be an elementary sample? Elementary unit.
Let's say yeah, exactly. Be careful.
So
you can use as you said, yeah, exactly. Let's assume that your tomatoes, your fish, whatever, they are elementary units.
So we have to.
Right. That's the different context. Are you getting my point?
Yes, sir.
So those in there are the elementary ingredients, whatever. We can term them as elementary units. And then you can see that elementary units will also come and form the sample.
Form a sample, yes.
Yeah, that's it. Thank you very much. Thank you very much.
I'm saying that.
Okay, so now let's move on to the last point after this. I think our time is almost up. So the last point here is what we refer to as statistical inference. We hear them saying statistical inference. So when you hear statistical inference, it's just a process of making a conclusion on the basis of the sample that you draw from the population. It's like you just generalize whatever that you found based on the sample, the information that you gathered from the sample, you are able to generalize the whole population. Okay?
To stop putting things in the vagina and leave the vagina alone. I bet you midwives leave your vagina alone.
That's what we refer to as statistical inference.
Let it and clean the water.
As I said,
so that
it all boils down to inferential statistics. You know, when you are taking a few times, just check the meaning of inference, check the meaning of.
You can achieve the pregnancy.
I mean, finite. Some of these things, I will advise you that whenever you are studying these things,
it allows the pH of the vagina to maintain its.
Just look out for the definition of the term, and now you relate it to whatever you are doing, not only statistics. For example, in your nursing, whatever, if there's something that probably you're not getting the point, just search the word itself. After that, you get what it means. You now relate it to whatever you are dealing with, and so it will help me. That's how I learn. Whenever I'm learning, I come up with something that I just look out for the layman's definition. In this scenario, what does this mean? After that, I bring it to my statistics, and okay, then this is what they are trying to say. Then you just apply it. So you can also apply it. This one is free of charge. Okay, so our time is almost up. So ending the class. God willing, we'll meet next week. Okay. So please take care of yourselves. Any question? Do you have any question?
Please, we will be happy if you send us the slide if you have a lecture.
I don't want you to be happy, so I'm not saying it immediately.
In people's minds. Please, and the video you talked about.
She's saying we shouldn't watch our vagina. Then the prince will be smelling. No.
Okay. Any other? Are you guys okay? If there's no question, there's a hand up
the
here.
human sense of the vagina is
Someone
like,
talk
and
to
that
me.
is natural. But
Yes,
Sammy. From this
I wanted to find out can an error in collecting data affect the population size and then the sample size?
Which there are a lot of errors. You have sampling error. You have
it has 4 different discharges.
The error margins, a lot of them.
It's a menstrual flow. That is blood, and it's normal.
At times you predefine your error and it really affects the sample size. You appreciate it when we start computing the sample size. You see that the error will affect it, and you see that as the error decreases, the sample size increases. And as the error increases, the sample size decreases. You see those things. I'll not do it, but I'll ask you to go and practice, and then you realize that that's what actually is happening in real life.
So the next part is also like improperly cooked starch.
Okay.
It's also normal.
I'll be okay. Now, basically, you know what sample is, you know what population is, you know the branches of statistics.
I don't want it.
And so, for example, for the sample, that's the reason why you guys, when you come to the hospital, you tell us to go for a blood sample. You see, you take part of our blood, and then we use it to represent everything within us. Is that not?
So please,
that's what you guys do.
That is it, sir.
So,
yes, sir.
Basically, that's what we do also do in the research. In any research you take part, it's costly. Okay, there was a hand up.
We have the discharges, we have
I think you guys are okay, right?
Yes.
We're okay.
My question.
Okay, so
you know,
we end here. God willing, we'll meet next week. Please take care of yourself.
Thank you very much. Thank you, sir. God bless you. Have a good day.
That's it.
Same to you. Eat fufu.
Yes.
Before we say that,
Good day.
They don't put it in the vagina as you're saying, but they put it in water, they dissolve it in water, and then they drink with the notion that it helps tightening the vagina. Please talk about that one too.
Oh, that one is it's a local medicine that we drink. That one is good. And I even like that one. It also controls BP. That's a different issue. When they drink it and it tightens the vagina for them, fine. But don't put things in the vagina.
Okay, thank you very much.
That's what I'm saying. Every question.
Please, I can't mute myself if you can help me. I'm doing it, but it's not responding. Yeah, it's not responding. Abigail Adafa.
Good morning. And what's that? More in Sunday. Sunday. One, okay. Very good. Yes.
Hey, Diane, mute yourself.
Okay. So that is it. Any question on the vagina? Let's move on to the uterus. The uterus is a muscular organ. Oh, please, when it is time for labor, you draw my attention, okay?
Almost.
It's almost time.
Yes.
It's almost time for
10 minutes.
Yes.
10 minutes.
10 minutes.
10 minutes to time.
If it's 10 minutes, then let's use it for questions.
Okay.
Let me finish with the vaginal discharges. I said we have candidiasis. It is.
Hajia.
Yes, please.
Please, so when you were saying the relations for the vagina, please, I didn't hear the middle one third well.
Those who heard the middle one third, can you say it?
It's the rectum. The rectum.
Yes.
And the lower one third.
The lower one third.
Perineal body. The perineal body. Thank you very much.
Perineal body. I said it. Okay.
Hajia, please. I have a question.
Ask me.
What is the pH of the vagina?
It's 4.5.
5. Okay,
Yes.
thank you.
And that's why we said we shouldn't be adding certain chemicals there. It only destroys or spoils the pH of the vagina. If you put certain things there, it ends up lowering, it will lower the pH. It becomes too acidic and it exposes you to trichomonas vaginalis. Even though it's a fungal infection, no, that one is a protozoa.
Augustine or say, oh.
Discharge of the vagina.
I'm seeing them.
Sisters, please.
I say all your breath. I've put them in the waiting room, so it's okay. They should go ahead and make that noise. If you can't comport yourself, what do you expect us to do? Don't do that. You do that, you destroy the lectures. I'll put all of them in the waiting room, so when they behave well, then they will come inside. Okay. So let's continue. So I'm saying that when you put certain things in the vagina, it destroys the acidic medium. That is supposed to be 4.5, the pH. It destroys it. Either it makes it too acidic, and you are likely to end up with what you call trichomonas vaginalis. You expose your vagina to trichomonas vaginalis, which is a protozoa infection. And the discharge is a little bit, it is a greenish in color, whitish greenish, and it causes itchiness. And it's offensive. It has a foul smell. That is the trichomonas vaginalis. Now the Candida albicans, that one is a fungal infection. It is caused by Candida albicans. The Candida albicans is the organism causing candidiasis or mononiasis. And the discharge is cavity. It is cavity. And it causes it is sturdy in nature and it causes what we call itchiness. When you scratch that by the fighting of bleeding. The sturdy nature is like a spoiled milk. It is a spoiled milk. That is how it looks like. And it is attached to the walls of the vagina. It's so itchy. The individual will stretch and that place becomes sore. That is the candidiasis. Then we have gonorrhea infection, gonococcal infection. That one is yellowish, frothy, foul smell. The side that is coming, it's like it contains some part. That is severe gonorrhea infection. It needs treatment. Needs investigation. So when the client complains to you that, Madam, I'm having vagina discharge, you can have the color. What does it look like? It's auntie, it is yellowish frothy. Sometimes I'll be there and it will come like a it's frothy. It comes like that, and it's offensive. You should suspect gonorrhea. If you don't have the facility where you can test for gonococcal infection, then you have to refer to a higher facility where they can do like vaginal swab and then isolate the microorganism that is causing the infection. So these are the discharge. Then we have what about STIs can you think about?
Chlamydia.
Through the vagina, that's why we are discussing it.
Trichomonas vaginalis.
Trichomonas vaginalis, I've said it already. I've described the Trichomonas vaginalis. I said it is called by those who are called trichomoniasis.
Vaginal what?
Vaginal wax or vulvar wax. That is also another contagious disease, highly infectious. So when the client comes and you are midwife attending to her and she's having vulvar wax, please, depending on the severity of the vulvar wax, advise her, educate her, call the doctor so that the baby can be delivered through the abdomen. Cesarean section will have to be performed. Don't let her deliver the vagina without wax. The baby will get itself infected. You, the midwife conducting the delivery, will also not be safe. So vulvar wax is something highly contagious. If the one is having just a little bit of vulvar wax after being, make sure you wash your hands properly before you yourself will go and urinate, or before you go and touch your vulva to urinate. Other than that, you get yourself infected. So that is it. What else? What STIs haven't we talked about? I've mentioned candidiasis, trichomonas vaginalis. I've mentioned gonorrhea infection that is caused by Neisseria gonorrhoeae. Neisseria gonorrhoeae that causes gonorrhea infection. I have described the discharge. What else?
Sister chlamydia and syphilis.
Syphilis. Yeah, syphilis will start with a syphilitic chancre. There's something we call syphilitic chancre, like a pimple. It will start at the border. Then sometimes it will be discharging, it is itchy, it's painful sometimes, and there needs further investigation to rule out whether it is syphilis. Other than that, it can affect the baby. It can even cause persistent neonatal death. So we need to address that. Okay, what else?
Vulvar vaginitis.
Vulvar
vaginitis.
Vulvar vaginitis is a sort of inflammation that causes inflamed area in the vulva. Sometimes it's allergic reaction, sometimes it is caused by microorganisms. So that if it is discharging, then we need to take smear. We need to take a smear and then isolate it under the microscope and proper organism that is causing the vulvovaginitis, then it has to be treated. So ladies and gentlemen, that ends the whole thing. we'll start labor. Do we break for some time and come back for the labor? Can we break for
Yes, ma'am.
No, Hajia.
No.
Please, let's continue, Hajia.
Let's rest.
Let's continue.
Let's continue.
Let's go for break.
Let's continue.
We want to breathe for a minute.
When we break and we come back, we will have to do transition.
Relax for a while. Break for 15 minutes and come back.
Let's go for break. It's important.
Hajia, please, let's go for break. We are
Hajia, break.
Negotiation being done with the transition tutor.
What is the time?
9 a.m. 15 minutes break.
So 9:15. 9:15, we are coming back, isn't it?
Please, which link are we using?
Please, we have transitional.
No,
Let's continue with the labor. Then we use
Why no?
Yes.